Hello guys, I am here with Stephanie Borg. She is a deputy nurse for 19 years and a holistic practitioner for 15 years. So today we are going to speak about the holistic approach. And I am curious to ask you, what triggered you from a nurse, which you still are, to begin studying into holistic practice?
So to begin with, I've always liked the medical side on, how the body works and everything about illnesses and how to treat it. But obviously, then eventually I was also interested on these natural therapies because I believe that what we hear about ancient times is true. That there are natural therapies, natural food. So I thought that, combining both together will give a holistic approach to how we can treat our body even better, body and mind and soul, obviously, because I always believe that what affects the mind affects the body, and what affects the body affects the mind. So, so I started also, studying a bit holistic therapies. One thing led to another. So, and nowadays I find that they complement each other a lot. So, interesting subject. Being on the medical side, I know better how the body works and how I can treat it, both medically, let's say, but I believe that we can always start first with natural ways. So that's a good combination.
Okay. So your idea is that eventually one cannot stay without pharmaceutical or the medical system that how we know it.
So they complement each other, but so I was telling you last time, sometimes being into medical as an urgent, something urgent, which yes, medicine do work, but sometimes when we take it, for too much, or there are the side effects. So I believe that if one can start treating something holistically with natural remedies, that's a good point. Then obviously there are limits. So I believe that if the condition is getting worse or not doing anything sort of better, yes, then I believe that we have to introduce a bit of chemicals to hurry the process or to boost the thing.
So from what I am understanding, okay, I am trying to be humble here, okay. So as a nurse, when someone comes in, I don't know if you are the first one who see the person, or there is the doctor that eventually has to decide.
I mean, it's together, but then obviously the nurse who stays most of the patients. So we are the ones who notice first signs of, certain things, and we notify the doctor. Okay. So we're the one, at least me, that I work in a ward, we're constantly watching the patients, and then obviously we like notice something, and yes, this is where, for example, where medicine comes in. If someone has something happens, acute, yes, we need to administer medicine. We need to do something. It's not like I'm going to give you, herbs or whatever. it won't do anything, obviously, at that time. So that's why I believe that we have to start with natural food and everything to prevent rather than to eliminate. Because once you have something, then yes, medicine is the answer.
So if someone comes in the hospital and he's acute, there is no way in your mind that he or she needs herbal medicine. You go directly to the pharmaceutical.
Because life is a matter of few seconds. So sometimes you cannot just, you have to. It's what the body needs to boost. So we cannot just give. Let me give you some herbs. Someone having a heart attack, or for many cases, not just that. If we need an immediate result, we cannot rely, because that's why I'm telling you it's good to grow up, or like from young age, to start with natural food. So we try and prevent as much as possible certain illnesses. But then obviously some things you cannot control, some things they just happen. So yes.
I in my mind, in my experience as well, from a person who suffered from digestive problems for almost 20 years now, I feel that the current medical system failed me.
Yes.
And in a way, I lost faith, and almost there's no trust in this kind of practitioners. It doesn't mean everyone is bad or whatever. I just decided to go the alternative route. And for me, when I studied herbal medicine, I understood that it is the primary route. It's not the alternative, it's the primary.
Yes.
And the primary means that eventually we begin from food, nutrition, exercise. And but when I went deeper, if you introduce certain herbs in a particular potency or purity, kind of like essential oils, which are one drop is equals to how much flowers or herbs, whatever. I think that the idea that pharmaceutical medicine is the most potent, I don't think it's true.
Yes, with regards to that, that's why I told you certain conditions, like an everyday life condition. Yes, this is where the alternative or complementary therapies come in, and this is what I work with and I believe in. Like even if someone is in pain, I prefer to use certain oils or certain, to treat the pain. But these are the conditions people live with, and they can improve it. But imagine if someone suffers, yes, from digestive problems, and all of a sudden they go into obstruction. It's a matter of life or death. It can be a matter of life or death. You cannot wait for the herbs or whatever oils to work. So it's where the medicine comes in. So acute cases, you need medicine or something which, yes, you need, because what happens if you don't treat something else can go wrong. So
think about, let's say I am heavily constipated, like blocked. I don't know why the first thing that comes in my mind is like castor oil. Did you ever?
Yes.
Castor oil. You can take it in, I don't know how many milliliters. When there is capsule, there is milliliters. So if you take, I don't know how much, maybe combined with other oils that eventually helps you move, I think it's possible. It will be diuretic, literally it will flush your system. Maybe there would be side effects like whatever they will induce in you in the pharmaceutical way. but eventually it will work.
Eventually, but until it works, it can do more damage. And because we do get a lot of people, sometimes there is a time where you have these patients who come in with a lot of with constipation, and yes, they have so much things that's still nothing. So it's where intervention or medicine comes in. After, treating them with medicine and everything, it's where I suggest how they can have something natural every day to avoid avoid the situation happening again. So the episodes to happen again. So it's there where then I change into a holistic therapist, telling them, listen, to avoid this, you need to have, but sort of every day, and this is where I'm saying the everyday life comes in, because you cannot pretend, you're not taking care, and all of a sudden, because you take something, it will work.
Yeah.
So it's there, even patients, what I suggest, even patients, for example, we have a lot of patients who come in with kidney stones because they don't drink. And it's there where I suggest how can they have water with natural things to always detox themselves. So I do suggest a lot of things while I'm at work. I don't eliminate, because I cannot contradict the doctor being in hospital as well. I cannot with my colleagues. But so I tell them, yes, do take what the doctor tells you. I cannot tell them not to. But at the same time, to help even more, or to find a balance, have this and that, or even they can massage the intestines in a certain way. The stomach, there's a certain way you can do it. I show them, why not? But
yeah, I would like to go a bit deeper on the drinking water. I have a problem with drinking water, and one of my major issues of drinking water, apart that I'm not thirsty eventually, but I believe the thirst comes from traumatic events that happened throughout my life. Example, even though I don't drink too much or enough, whatever, I don't drink a liter a day for sure. So for me, it's low. I go frequently. So imagine if I drink 2 liters, which I did in some cases, I tried. I was like going to the toilet almost every 10 minutes, in an hour. And if I am a person who is working as a delivery person and is trying to go from Zaytun to Orly and whatever, and there is a traffic jams in the street, where is the toilet there? And I got in connection with people who eventually suffer from IBS. And one of the greatest issues is that they are afraid of being into the health system, or maybe the holistic way, because the system, maybe the working place, they don't provide certain public convenience. It's if you are driving and you urgently need to relieve yourself, where you need to park, where is it open, and there is confusion, like and uncertainty, and it's like the person decides better don't drink, and then when I go home I drink whatever. So it's like starving yourself from water until you get the job done. And this is happening for many people, and I believe if you are a massage therapist, if you are doing massage and you need to go, you think better before I don't drink and then I drink after the massage, because I don't want to stop the therapy, because it will ruin the point.
Of course.
So there are certain predictions that the mind exercises, and prevents us from being healthy.
Let me go through this step by step.
Yeah.
So sometimes when we're going to the bathroom, when we're passing urine without drinking, there might be an underlying condition. So one needs to check. Okay, so that's something which, if people tend to go pass urine a lot and they're not drinking, then they need to be checked out for sure. And this is where medical comes in, because obviously we need medical people to examine us and test and whatever. Secondly, I'm someone, I have a condition, okay? And I cannot stay off water. I can drink even 5 liters a day. Even if I don't want to, I have to. It's my need, I cannot not drink, okay? So I find this problem, yes, where I'm doing errands and all of a sudden, in a split of a second, I urgently need to go to the bathroom. So I face this problem every day. So what I'm getting used to now, if I know that for sure I'm going somewhere, I'm not going to find a bathroom, I only have small sips. And then, to avoid thirst, I keep, so because of my condition, I keep chewing gum. I don't like it, mind you, but I have to. So we can, a day has 24 hours. Okay, so let's say in those 24 hours, we sleep 7 hours. So what, there is 18 hours left? In those 18 hours, don't tell me you're going to be 18 hours running around doing errands. For sure not. For sure not. So again, it's time management. You can avoid drinking water. Like sometimes I don't want, but I have to do it. So that's why I have sips and this gum. But in that hour, 2, 3, 4, let's say, I avoid drinking so much water, but the rest of the hours,
then you fill up.
we're at home, so we can easily.
Yeah, I found it. Example, if I don't have any errands in the morning, I really found it. Example, I have a bottle, like a 750 ml bottle, and that is my breakfast.
I'm always with this.
And that is my breakfast. And when I used to drink water as a breakfast, like fill up, like drink as a whole, like full, because sips, it doesn't work for me. Or I drink it all,
you drink, yes,
or I don't drink nothing. And it doesn't matter if it's cold or room temperature. I prefer more room temperature. And eventually, even if there is some essential oils in it and just a little taste, there is no need so much sugar. I found it very, very healthy even for my mind, for my body. I feel better. But eventually, in the morning, the first 3-4 hours, non-stop. So that bottle will go down to the toilet easily. So it is something that eventually the holistic approach, which eventually we are discussing into, I find that some people say easily said than done, right?
Yes. But so, as like if we really want to do something, something difficult, like I was telling you before, that there is never a motivation doing something difficult. It just has to be done. Mm-hmm. And when you see results, even then it motivates you to continue. People don't realize that when they keep themselves dehydrated, they get muscle pain, headaches, and for many people who work long hours at the office in front of a PC in the same posture won't realize that one of the causes is keeping them dehydrated. They cannot concentrate, so they lack they lack so much from even being focused. And when people start getting into the habit of drinking, they realize that, they start off working better. Then obviously during the day, yes, everybody has stresses and everything, but at least not having a headache is already, a big improvement. So sometimes until people start doing something and yes, get into the habit and then being a lifestyle, the start is never easy, never. I mean, even me, that I train almost every day at 6, as if so many times I feel like staying in bed. But after the session, I feel so energized, ready for the day. Like, I'm starting my day early and I'm full of energy. Obviously, I drink a lot. I drink, without training. Imagine when I'm training.
Yeah.
So, so sometimes it's just trying to find a balance. Like in life, you always have to find a balance. Nothing comes easy, and nothing comes, as we want it to.
Of course. Yeah, you need some motivation for sure. You need to press up that button and see the end result. And there is once you have this exercise ready, you will feel better. Maybe not today, maybe tomorrow or tomorrow.
There is no in my dictionary. There is no maybe. It's either tomorrow or nothing. It's usually saying maybe I start today or maybe I start tomorrow.
Yeah.
Just go for it.
Yeah.
It's not easy, mind you. It's not easy.
What I experience, I don't do so much exercise. What I experience is that even though I don't do so much exercise, I am already stressed. Imagine if I exercise, how stressed I would be more. So it's a kind of mindset that sometimes it is not logically like this. When you exercise, sometimes you feel more energy instead of taking it. Maybe you drink more, you eat more, but there is some upliftment that eventually you did, even when you think, you did something good for yourself. It brings on certain powers.
Yes.
And it's once you feel, experience it, I think you can manage. Then we have to go to time, because time management, right? So if my shift begin at 6 and I wake up at 5, what time am I going to train? At 4. So
no, everybody has his own, it doesn't mean that I'm a morning person, because there are many people who are evening, people. So for me, after work, I'm like kaput.
Yes.
For many people, it's the other way around. So everyone has his own way and his methods, and not just exercise. I mean, for me, holistic, it's taking care of yourself by loving yourself and taking care of your mind and body. If it's not exercise, because in reality, not everyone is a sports person. So I cannot force you doing something because you'll get injured. Okay, good for me, because then you come for a massage. but the point is, you have to enjoy as well what you do. So for me, the holistic approach is read. And while you're reading again, or play music you like, do that something for yourself, to take care of yourself. And when you do that, it's, you feel that you accomplish something. And that is where we feel good.
I am in a very strange place when you say that, because, I'm here with you. I'm not exercising. I'm still here in my chair. But eventually I feel I'm doing something for me. And this connection that we are eventually doing here, it is satisfying. and hopefully it will be satisfying also for someone else who is watching. And I feel that I did my exercise.
Yes, it just can
No,
be. It's not just an exercise. It's not just physical. It's even mental.
yes.
Mentally. So
This is something that when you are into spirituality, you get sometimes you get a bit lost. That I am speaking with someone who is eventually he really needs to take care of himself. His physical body is growing, and eventually you cannot take care of people, and you see yourself going down so much. So there is a limit, there is a boundary, and you need to respect it. So about the holistic approach, when you consider the general practitioners, the doctors, the first liners, do you think that eventually they are applying this holistic approach?
no, their first thought is always medicine. It's always medicine. I mean, we study medicine, we're trained for medicine. So maybe nowadays you can find young doctors who are reading more about natural, cures. I know of certain young doctors, and not just the young doctors. Then there are the other side, people who lived, but unfortunately those are now aging. And
So if you see, if you tell me like a percentage.
Oh no, it's very low. It's still very low.
Low, you mean low holistically?
Yes,
low in the
yes,
holistic.
yes.
And
But
if I wish to go into that as well, do you think that a practitioner can be considered holistic when eventually his session is around 10 to 15 minutes?
What do you mean? His session 10, 15 minutes?
So imagine I am a general practitioner, and a person comes and the session max is 10 to 15 minutes. Can I, as a practitioner, be a holistic practitioner in 15 minutes?
So like for someone going for consultation?
Yes, it's the first consultation. Let's say the first consultation, the person comes with whatever, and eventually there is a list of people waiting, and I cannot stay more than 15 minutes because there are appointments, right? So
yes.
can I, as a practitioner, which maybe I call myself as a holistic practitioner, make it a holistic session in 15 minutes?
I don't think so.
All right.
I mean, yes, unfortunately, time, yes, sometimes reduces even the quality of work. So imagine if they try to include the holistic approach. So you can, let's say, help the person, but for sure, you need to follow up. In 15 minutes, you can, but it won't be complete. In 15 minutes, I can easily get a conversation sometimes with a patient. Yes, I know. It's because I already know the medical history.
Okay.
And then I speak.
It's not the first one.
So imagine I have a patient in the ward. I already know the medical history, and then I approach with a holistic approach. Yes, in 15 minutes I can do it, but because I already know the medical history and I can see certain alignments, on what to talk about.
So let's say, so imagine if I am the same holistic practitioner that eventually has only 15 minutes. Do you think, example, in the appointment, instead of taking 10 minutes or I don't know, 5 minutes, checking the whatever medical history, and do you think that in order for the holistic practitioner to work better, he prepares these documents before our session. You know, because
Yes.
some
Yeah.
people,
Yes. Mhm.
because some people complain. Example, they eventually some holistic practitioners or general practitioners, I don't know, professors, they take 80 euros for 10 to 15 minutes,
Oh,
and they
even less.
and you know uh,
I know.
and 5 minutes of that 15 is writing what's your name and maybe simple things. So if you already know certain details, you already has a kind of preparation.
Yes, but sometimes, you know, if you're going to a doctor um, because of a spinal problem, you're not going to tell him about your kidney problem.
Mhm, mhm.
See, so it depends. You know, these doctors, you can't go to someone, an orthopedic, and you speak about your kidneys. So
Because there is a specialization. So
specialization,
yeah,
obviously. So the only history he will take is about your orthopedic condition.
yeah.
If you tell him about other things,
And,
obviously.
and you are telling, you are putting something in my mind, because how can you be holistic when eventually you don't know the general
That's why it's
practice?
difficult. But that's why I'm telling you, when you a doctor who is specializing in something, I mean, even me, if I want to go to a specialized doctor, I choose and I refer clients to whom they go. So it's their field, and obviously that is what
Ah,
doctors specialize.
what do you think
But
if there is a team? Like instead of we are focusing on one example, when I have a digestive problem, and maybe it's IBS, but eventually there is a gastroenterologist and a psychologist, because it could be mental, it could be physical, or both.
in Malta, I first refer to to a gastroenterologist in Malta. The mental care, unfortunately, I don't like, because they just psychologists, yes. So if I need to refer them to a psychologist, I make sure a psychologist,
Mhm.
not to a psychiatrist.
Uh-huh.
They're
Mhm.
totally different. And I don't think they really work hand in hand, because, you know,
Eventually the psychiatrist is more expert,
it's
special,
what?
the psychiatrist.
No, they're both specialties. But psychiatrist, he will give you medicine.
Uh-huh. Just
It's
that.
medicine.
That's
I mean,
that.
he will talk, he will give you advice, but
But is it
he complements with tablets.
not every doctor do like that? Like if I go with some
Psychiatrist?
no, not even if you go to a general practitioner,
Ah, yes.
there is already enough. If you have a headache, take this. If you have a problem with diarrhea or constipation, take this. There's
Yes,
always
yes.
a tablet. Yeah, you know.
Yes, but psychologists, no. That's why I'm telling you.
Okay.
So I make sure that if I need to refer, sometimes I always refer first to a psychologist.
Mhm.
And then there are psychologists who refer to a psychiatrist. But I always refer to a psychologist first. So if someone, for example, comes, yes, gastric problems, even when, let's say they come to me with pain, persistent back pain,
Mhm.
you know, and what I'm doing is not enough. So there must be an underlying condition. So yes, I would refer them to a specialized doctor, because then with further tests, you can obviously pinpoint the problem. I remember I had a client once, she used to come, I know she was an anxious person, and she always tells me, but I have this pain here, and it's like, palpitations. And so at first I said, let me try and reduce the anxiety. It did help, but she still was feeling something, you know, after 2 or 3 sessions. I told her, listen, go and do blood test. And I told her, which blood test? Thyroid. 2 days after, and she's still up to this day, she says, thank goodness it was you who referred her for blood test. She has her thyroid sky high. And it was going to lead her into big problems. Then obviously, yeah, she needed tablets. That is where tablets came in. So I cannot try and take care of something which is not my field. She needed those urgent things. Then yes, she's taking natural things and everything, and now she's improving so much. And even the dose has reduced so much. So we can eliminate tablets. So the emergency was tablets at that time. You couldn't not give. And then eventually, even myself, to be honest, with my condition, doctors said, my goodness, you're improving so much. And then they are reducing my medicine. I tell them, but you know, if I tell them what I'm doing, and it's like your
condition, because the people who are watching, they don't know what condition you have.
So I have Sjögren. So basically, it's an autoimmune. It's dryness, and it can attack, which did happen, other organs. So there was a time, like a few years back, I was really bad, and it attacked all my organs. So I started off to you know, to try and suppress everything with high doses of medicine, which I urgently needed. Otherwise, I wasn't going out from the hospital. And they did help. Eventually, then I started. I was always into the healthy habits, like even healthy eating and everything. But I introduced more exercise, training, was more careful and reading more labels of what I was eating, introduced more natural things. And by time, I mean, I'm taking, you know, the doses have decreased so much, and it happened even quite fast, because when I did follow-ups, doctors used to tell me, like, you having so much steroids, you're a person that you cannot, you know, go through that door, but instead you're losing weight. And I was losing weight by being healthy, not because I was starving myself. Because what I did, and it's there where I started believing that mind over matter. So I know that and I know all the side effects of steroids, that you gain weight. So I said to myself, okay, I'm not going to, you gain weight, obviously, because you have cravings and you eat more. So I said, okay, I'm going to let the steroids work medically on my condition. What affects my mind, being hungry and everything? No, that's not me. I'm going to ignore. Oh, yes, I had that cravings, of course I had. But I said, no, I want to let them work on my condition, not mentally. I don't want them to affect me. And I was so strict about it. And instead, I started into more training and, you know, eating healthy snacks. And if I had cravings, going into the healthy products.
So eventually, you as a nurse who eventually knew really well what steroids are, you knew the side effects, and you prepared yourself mindfully,
of course,
to do that.
I'm still having them.
If you had if you was a normal person who will not work as an operator in a factory, you just wait for these cravings and say, oh, I need to eat, so I eat, and then I will get obese. The point is this, and you said that eventually you worked on your mind, and you are still continuing, because these cravings continue because you are still taking these steroids, right?
Of course.
There are like there is like a kind of, how to say, a war inside between the physical body and the mental
Yes,
state,
yes, there is, but that is when mind,
which creates pressure, which creates stress, right? Which not everyone is ready for that pressure.
no, but if you keep on reminding yourself, and this is, for example, to give you an idea what I have on my mobile, you know, because sometimes it's good to remind yourself about, so let me show you. Oh, this is what I have as a wall, which I suggest.
Mind over matter. Okay.
It's always there. This is a picture
So a reminder.
took.
A reminder.
Yes. So this is for me. Everyone has his own thing, obviously. But even so, when natural things come in, you also have to be careful. And even when I talk to people, like I have to see what medicine they are taking, not to create
of course. Contraindication or interaction.
Contraindication. Even me, that I have immunosuppressants, I have to be careful what things to have for my immunity.
So if I may ask you, imagine that somewhere in this universe, there is an alternative medicine that eventually works similar to immunosuppressants or steroids. I don't know exactly what are you taking. And these cravings go away. Because eventually it works in a synergistic way, but there is no side effect of craving. You have the immunosuppressant, you have the steroids naturally, but there is no craving. Imagine, there is no pressure, no mind over matter.
They don't work as fast as the medicine.
Maybe,
yes,
maybe we are missing that herb, that dose, that how to introduce it. Maybe, you know, you need a special capsule to enter in a enteric coating, you know. I am into specializing into that as well. I'm also trying double capsules. So, but eventually, I truly believe that these steroids, these pharmaceutical drugs, they come from something which eventually God made. The person, the human mind, works on natural materials. For example, if you think about this laptop was made from natural materials, right?
Can you give me 2 seconds? I pass my mobile to my mother because I have an urgent call. I'm coming.
Well, I will continue. Can I share the screen?
Yes.
I want to read something with you, and I am really curious what you think. It's from this book. I don't know. Heal Your Gut with Essential Oils by Dr. Eric Zelinsky. Eventually, he said this in the end of the book. And he's a very open-minded person. He's not just focused on just essential oils, but eventually he tries to see the whole picture. I see him as a holistic person. So what he said in the end of this book said that modern medicine is the #1 cause of death worldwide, included in the long list of reasons why are medical errors, side effects to unnecessary surgeries, and you guessed it, adverse drug reactions. In fact, adverse drug reactions kill more than 1,000 to 5,000 people in the hospital alone, and those are just the reported numbers. The Journal of Law, Medicine and Ethics calls this a hidden epidemic of side effects from drugs that have few offsetting benefits. He said that eventually the safe solution, what is the safe number one cause of death? To stay away from unnecessary prescription and over-the-counter drugs and use plant medicine instead. The key to understanding this last sentence is to know what unnecessary means in regards to medicine. Necessary medical interventions save people from death. Necessary medical interventions help people cope with pain and suffering, whether emotional, mental, or physical, when nothing else helps. Necessary medical interventions are rarely the first line of defense. They are normally a last resort. Necessary medical interventions should be temporary, but this is not the case for most of the people. Millions of people are becoming aware that drugs and surgery are generally not the best first approach to their health issues and are frantically searching for natural options to the harmful medicine that they are taking for their health problem. One natural solution that keeps coming up is essential oils. Why? Simply put, because they work. If used properly, essential oils are one of the safest, most powerful natural remedies, and we have a long history of use to guide this journey. So it's interesting how I really love this doctor who eventually see that the holistic approach is contrary to what you said, is the last resort, it's not the primary resort. And eventually, we need to see as a holistic system, not as you as a nurse or as a doctor, but as maybe the prime minister, the government, okay? Why people are going always in emergency mode? What is happening? Why there is so much depression? Why there is so much digestive issues? Why there is so much people with vulnerable conditions? And are we acting the system, the society, the program is not holistic?
No. But this. I mean, I said that medicine is that's how we are. That's what we are doing. Using medicine, the reality. That's what we are doing nowadays. That's why I said if we start from young age,
yes,
with this holistic approach, we avoid. But nowadays, you know, the first thing is that. So I mean. Yes, I agree with him totally. I love what he said, and I'm going to ask you to send it to me as well, please, because it's really
sure.
But to avoid having the primary, we have to start, like he said, because I believe in the power of oils and everything. I mean, I'm also an aromatherapist, so I believe in them so much. So. And that is, I am also believing even more because of what I'm passing through personally. So, but yes, unfortunately, that is the reality how we're using medicine as the primary. We can avoid it, but in reality, primary is the medicine.
You know, my beliefs is that we have lost certain knowledge. That when we dose, in example, if you take 10 drops of lavender, it will affect your emotion like almost instantly if you take it internally. So it's something that you can use it as an alternative, as an antidepressant or something that can eventually calm you down in few minutes.
And it works. It really works.
And that is just one, because there is vetiver, there is copaiba, there is frankincense, there is ylang ylang. There are many herbs, you know, that you can use. that is just one, and it's one of the the most common. So maybe we have knowledge that is yet to be rediscovered, because I believe that we already discovered it, and we just need to implement it as the primary, even if there is an emergency. If there is like a blockage, this person is going to die, and I'm going to try enough, I don't know, grapefruit, okay, lots of grapefruit in essential oil form to try to dissolve that blockage. And if it doesn't work, maybe okay, I go to the last resort, which is pharmaceutical.
Yes, yes.
So
that's why I tell people, to avoid, so after you had that episode, now to avoid it, start with the natural.
Yes.
So yes, I'm with you. Yeah.
I think even in the emergency mode, we can use natural remedies. Just we need to empower more.
What's the problem also? Not the problem, the situation.
Yeah.
It's money.
Yes. Money. It's business.
It's money.
It's business. It's business. And you know what? And you know what? Yeah, because eventually I work with essential oils, and I see how much expensive are these oils, even pharmaceutical medicine. So
but believe me, they last longer than the tablets.
Of course, but eventually some people say, this bottle is too expensive. I prefer to take an antibiotic instead of buying oregano. So which one should I choose? And when you understand that certain prices are kept low from subsides of the government himself, because the government is supporting the side and not the herbal side. So we are pressed like from our heads, go pharma, go pharma. And probably because the government is controlled by the pharmaceutical companies as well, the private sector. So how can we be holistic? How can we work the holistic approach? You work 19 years full time as a nurse, right?
Yes, yes.
And you work 15 years as a part-time holistic. So it's already an evidence that the people doesn't go holistic, they go more pharma. If it wasn't the opposite, you would go full-time holistic, right?
But I love nursing. I love the bedside nursing. I love the continuity of taking care of someone. And me personally, I'm saying how I work. Sorry about the noise.
Okay.
And me personally, even though I'm a nurse, because I love to know how the body works and what happens. But me personally, I always see my patients, my clients holistically. So as I was saying before, I take care of patients. I always include a holistic approach with natural things. So I don't contradict the doctor. He's my colleague.
Yeah.
But me as a nurse, maybe someone else who's been longer a nurse always practices. But me personally, I practice both. So if someone comes for a massage, like I told you, yes, he needs to further test. And then whatever the cure is, or whatever the reason is, yes, they can come back to me and help them in a holistic way.
Yeah. Yeah.
But that's how I work. That's why I like it, because from holistic approach, me that I know the body helps me more in being more holistic, to be honest.
Yeah. When I think about, because I know you as a holistic practitioner eventually, not as a nurse, I see you that you have great potential, that eventually you can be the doctor and the nurse and the massage therapist and the counselor or psychologist, whatever. So
many people come to me saying you're my psychologist.
So and if everyone puts his mind into holistic approach, if you really want to be a holistic person, you need to see the whole picture.
Yes,
The
yes,
whole
yes.
picture meaning not just the person, but you have to see
Of
yourself.
course, of
The
course.
knowledge is
Yes,
like
yes.
if you want to be the owner of this house, you need to be the plumber, the electrician,
You need
yeah,
to know what's happening inside.
everything,
Yes,
you know. So that is the holistic approach. It's like the general rule of life.
yes,
So
yes, yes.
and in my case, I would prefer you to be a holistic practitioner full time. I think you will serve better. Then there is no restriction, there is no wall, the doctor trying to limit you from doing whatever you feel. Because I feel in 19 years, surely there was something that you didn't accept or agree with the doctor and eventually had to do it, right?
From the doctor's orders, yes, obviously.
Yes, of course. So,
But as a one-to-one, me
mhm,
with the patient, there is the certain relationship. It's a job which gives me so much satisfaction
yeah,
because there is a one-to-one care. I don't know how to describe it. Maybe people who work in the medical field or our nurses who are truly dedicated, can understand this.
and the
It's
patients,
not about Mhm.
are they live there like a temporary,
Yeah,
or
impatience.
they come and
Impatience.
go, they come
They
and
come
go.
and go. They stay there as an
Okay,
impatient. So
so
you get to know.
you have time.
Yes, yes, yes. So that time for me with the patient
Uh-huh.
is something I think I would miss
Hmm.
because I'm caring as a medical, but me again personally, because not all nurses obviously maybe work the same. To be honest, I'm in a team I love, so we all care for the patient, and because sometimes patients also need just to talk,
Yeah,
and if I have time, I give that time to them.
yeah,
And instead of taking the sleeping tablets, they say I feel so good. I try to avoid it, and they don't have it.
because they talk to you.
Yes, because it's I always give examples in life of how they can deal with life.
Mhm.
So that is for me, it's caring, it's a holistic approach. Why should I give a tablet when I have time, you know,
Um,
and tell them and avoid them having the tablet?
yeah, you know, something else that is coming to my mind is that one day uh, I dreamt of a Mother Day, and I went to the reception, and eventually I told the receptionist, I told her, I have digestive problems. I really need to see someone. And the woman who was the receptionist showed me on the back, and there were two doors. And she told me, what do you want to see? Like a nurse or a doctor, a professor, a gastroenterologist, and so there was the pharma door, and there was the other door, the alternative door, or maybe the herbal door, and
Natural.
and eventually there were people, herbalists, naturopath, and the other side. And she told me, no, choose which door you want to go, the door one, door two. And this liberty, this choice, that I had the option
Yeah, the
to
freedom.
choose, the freedom I really, instead of tablet, I really want a massage now. I pay the taxes, and eventually I believe I don't need to always pay a private person to do a massage. I think if instead of giving me tablets, I prefer a massage today, I see how it goes. And you work as a practitioner there in Mater Day and do massages as your job. And I feel that if Mater Day eventually gives this option, many
Oh, that
people
would be great.
will choose door two. Yeah.
It's true. I think Maybe they should do it, you know, and they should do an experiment actually with this.
You know,
It would be, you know, people can choose. Why not?
yeah,
Why
but
not?
I think the why not, we already talked about this, because there is money. And the people who are controlling Mater Dei, they don't want door to open.
Of course.
That is the problem. And that is why my dream is to create another clinic out of Mater Dei, which is not one person, but many persons. It will be a holistic clinic. And you don't just sit down, but eventually you can stay there and make a weekend or week. And there is like a kind of rebirth center. So, and you can wake up in meditation, you can do yoga, you can eat like a plant-based diet together. There is nutritionists. There are many people who eventually become
definitely.
a family, you know?
You know, but before I got into this business myself, I used to dream about this, to be honest. But again, it's not so easy, because then again, permissions and everything and money and
of course. And you know, what I see is that the holistic practitioners are like fallen angels. They are like everywhere divided. And imagine if these, you put them all together in one place, and eventually they practice from body, mind, soul, you know, and
yes.
there is a holistic place, not just the approach, but there is the holistic place. And we are working as a team. And if you are in that hall, yoga hall or studio, whatever, maybe you are outside in the clinic, there are all the practitioners that are available on that day, which you can speak in that time, in that moment. You don't need to wait for whatever booking.
Yes.
So I think
You
that is
know,
something powerful.
yes. In fact, like you were saying, it's sometimes if a client comes in with certain, let's say, gastric problems or digestion, if I see that, you know, it's something which he can treat himself by telling him, you know, referring to a nutritionist or breathing exercises or how to reduce anxiety, because sometimes the problem is not the organ, it's the cause. The cause is something else which we can work on ourselves. So yes, sometimes, many times I tell them to start with certain things. Breathing exercises is one of the things, you know, that helps a lot. I mean, that's another subject, actually. But yes, I always suggest do things like, but this client, for example, who was telling me, you know, palpitations and everything, then when I get a bit concerned, I need to. But my first thought,
I think that when I think about this clinic, when I think of, because as a holistic practitioner myself, I think about the clients, but I also think about the holistic practitioners. Because even when you, as a holistic practitioner, we are not gods, right? We need sometimes more support than the client himself.
yes, especially when you get
so
everyone.
So when the holistic practitioners work as a team, they support each other.
Yes, I love teamwork.
And when the group is not one, it's a group therapy. And when there is someone who suffers from anxiety, maybe the first hour it will be a bit disaster. But once you get to understand that, you know, I am in a very friendly, safe place, I am with another family here. And this feeling, just this feeling, is medicine.
Yes.
And you know, and many people just miss this connection.
You
Yeah.
know, sorry, continue.
Yeah, and this therapy, it's so much, I feel there is so bi-directional force that it's not just working on the individual who suffers, but also the holistic practitioners who eventually suffer as well through the holistic approach, because it's tough, you know, in order to focus on the person. I know sometimes I converse with 3 hours, you know, to understand the holistic approach of the person, and it's tiring. But imagine if these 3 hours is divided between 5 to 6 people.
Yes.
Most of the time I'm listening, not talking. So, and I'm learning too. I need it. I need therapy as well, because I'm not the healer. I'm not
Everyone
the,
does. Everyone does. We all have
so
our moments, obviously.
well, you know, and so why in Malta we don't have this clinic? And there is also something else. When I think about the holistic approach, there is this holistic word. Is like the boom of today's era, you know, the physical, the mental, the spiritual, right? Uh, you know, for me, it's four. It's not three. And four, it's the financial as well.
Oh, yes.
Because
Yes,
if you are
definitely.
helping the person physically, mentally, and spiritually, and draining his energy in financially, you are putting the person back to work to lose his physical, mental, and spiritual. So when a person, whoever it is, whether it's pharma or holistic, and takes or asks a kind of amount of money, which is, for me, it's incredible. Uh, for me, that is not a holistic approach. You are not working right. There is something wrong. You are not understanding that you are draining this person from vital energy, which needs to recharge. It's like a vicious circle. You come to me, I take your money, and you will come to me again, and I will take your money. So I see that some holistic practitioners, I am not saying many or low, I don't want to put any percentage, but there are people in Malta and even outside Malta that eventually they take so much. You know, I just uh, uh, maybe I can what comes to my mind. Example, there is people in America. They use marijuana, cannabis oil to treat cancer. And they see that not just there is not the effects of chemotherapy, but it works better than chemo. The problem, you know what is it? Because 10 ml is 1,000 euros.
Mama.
10 ml. And sometimes we complain about frankincense, it's 100 euros per 15. But this is, but to save a life, would you give 1,000 euros for 10 ml? And this is a trial. They do trials. It could work, it could not. You are draining so much from the family to give something, which eventually you need to recharge it back. So we need, as a holistic approach, we need to consider really, but really consider the financial approach as well.
Of course.
That is why I, in my case, I don't have any fee. I let the person decide what fee is it, and if he's ready to give it now or later, or maybe you wish a refund. Because if you come to me and you know, I tell you, I think you need a psychologist, not a nurse. So I should not pay you as a nurse. You didn't do nothing. You just referred me to the psychologist. Why should I pay you? So I think that is a freedom again for the clients to understand that eventually your approach was worth nothing, like zero. So, and that is, I think it's part of the spiritual approach, part of the holistic approach as well, that we let the people act and decide, and we accept their choice. It's everything is it's going around liberty, freedom.
Yes, yes,
You
yes.
know, you can decide that it's your choice. If you think about the vaccines, you can take the vaccine, or you cannot take the vaccine. But how if you don't take the vaccine, you are someone like trying to make the virus bigger, for example. Then there is judgment. When you see like this, you understand that this approach is not good. When there is no freedom, so why in Malta, at least in Malta, because we live in Malta, right? Why we, as citizens of Malta, we don't have the choice to choose whether it's herbal or pharma?
It's all, it starts from the top. And unfortunately, these factors affect our decision, especially not like us, maybe that we have the knowledge, but people who have no knowledge, or they're not interested, or it's not introduced, you know, for them there is no option because they don't have the knowledge. So that's why it has to, you know, to start from us, teaching the people we meet and tell them about our own experience. So at least, you know, these people can increase eventually. It's a slow process, but I believe that the young doctors are more open-minded. So, because I know myself, young doctors who try not to prescribe certain, you know, or antibiotics or whatever, if they know that something natural can work better.
Yeah, but you know, eventually,
But it has to be like you're saying, for someone to have the freedom, it has to be the person on top to know about it.
yes, you know, I'm going to share with you an experience example when we went to the birth of Noah. My wife Chantel was not open. Was like that it was a date because of the placenta. They said it was old and we needed to eventually induce, which I don't like, not some part of the procedure, right? And the doctor came with this gel and told, you know, this is going to induce labor. And I told the doctor, please, do you have something natural instead of this synthetic whatever? And this doctor coincidentally was very into deep herbalism and like this. And you know, and he was telling me that eventually, if I knew something, I couldn't even give it to you. You know why?
That's why.
Because this is what they give us. If you are in a garage and there is the owner gives you the tools and you are the mechanic, eventually you have to use the tools of the owner, even if the tools are not good or not enough. So don't come here if you want that tools. Where should I induce? My wife, if not here. So there is no option. You have to do it.
That's what I'm telling you. Yeah. So people would like freedom, but there is no option. It's a one way.
Yeah, there is no option, and that's why I feel there is so much, not depression, like we are in prison. We are in prison that, you know, we are free to say whatever the way we want, but eventually we need to do like they want. Yeah, you need to follow the rules. You know?
Well, you have to, yeah.
So You can say whatever you want, but you need to go 8 hours a day and eventually pay the taxes. And
Yes, yes.
if you have a problem, you need to go to the doctor. And if there is a holistic practitioner, he is not licensed to do whatever. It is her own kind of responsibility.
But on the other hand, then to be honest, we also need to have trust in also in doctors. Like for example, in youth, no, it's not nice, but for sure, they're doing the best they could to keep the baby and mother healthy. So they're choosing the best option. So in that case, then you have to trust in them that they are doing the best they can, because I get mothers who are pregnant because I also do the pregnant massage and I prepare them for a lot of things that can come up unexpectedly. And
Yeah.
I always tell them you need to trust the doctors, because ultimately they have a life in their hand and they're going to choose the best option and the best they could to make it successful. So don't refuse, or don't get depressed after, because ultimately, at the end of the day,
Yeah.
as long as both healthy, you just need to put trust. They know what they're doing.
What comes to my mind is this: we trust the doctors, and the doctors trust the instruments, which the
They have
same
confidence. Yeah.
which the same instruments, if you think about cancer, they are those who promote it. If you think
Yeah.
about the breast cancer, when there is the screening, I don't know which kind of screening, there is radiation, and they tell you, no, you need to check every year.
Yeah. Yeah.
The screening itself creates
Yes.
cancer. So,
but there is a limit to how much.
but still, some.
Yes, but having in fact people who work in these departments to protect themselves, there is a shield.
Okay.
They have to wear a shield because
Okay.
there is a limit, a certain amount of race, how much the body can take. So yes, it does harm, but
Yeah.
on the other side, personally, if I analyze everything in life, I just can lock myself in a room.
Yeah, but think about the vaccine example.
Yes.
There were people who took the vaccine, nothing happened. And there
Yes.
were people who took the vaccine and they died with the vaccine.
Yes. Yes.
So even though they
It's
need it, they don't accept it, because sometimes the people who are in a different levels, they are in that borderline that when you put something which is maybe harmful at a certain level, you let this whatever come out kind of cancer. So it could be that the woman who is eventually going every year screening the breast to check if everything is all right, it's slowly it's putting certain pressure, and after time the screening itself is promoting, and after 4 years going, and we got
but
something. We got something now, but eventually it was the screen that was causing it.
no.
Could happen.
Yes, but no. Sometimes the body, if it's, that's why I'm telling you, like if we keep on and then analyzing, you just live in fear that everything you do is going to, if you think bad, you will attract bad. So that's life. So I'm now in life living, I cannot analyze anything I do, everything I do, because it's too much. I will live all the time with question marks, why, when, how.
Of course, but think about. Please excuse me. Think about the breast cancer. As a nurse, I believe there is something else that we can use, which is not promoting cancer, and eventually we still know that there is maybe like blood tests. simple nuclear
Not
or
always,
whatever.
not always, not always.
There is nothing that we can
Blood
do.
test, I mean, the first tests are always blood tests. It's an indication, but to see how bad, where it is placed or what to do about it, you need, unfortunately, these scans. But they're the tests which can help you to improve. There are many people who refuse radiation and chemo then, but at least they know about it. And there are many people who do well still without chemo and radiation. But when you know something, at least then, yes, the person can refuse. There is the option to refuse, but it's good for the person to know. And only these tests. I mean, again, to be honest, there is other natural medicine, you know, the Chinese discovered the body without the medicine and the anatomy.
Yeah.
So, but nowadays it's not like that. Unfortunately, I'm not saying that I agree totally. I'm saying that the reality, and when you live in realities, you have to stop asking certain things because it will only bring fear. And
so it's a kind of surrender, right?
yeah, but but at the same time, trusting that it's like me. It's not that I wanted to have all that medicine, and obviously, so I looked at it in that way, like, okay, it will work on my medical condition. I don't want, you know, it's not easy. It wasn't easy at all, mind you. I'm saying it now because obviously I made it.
Of course.
But I had to, I mean, there was no option except to trust. And from that, I grew stronger. And, you know, I'm got into more holistic eventually approach because I know that that is not the answer. So sometimes you have to go through tough things for us to approach something else or believe more in something else.
You know, when I think about the holistic approach, for me, time is the most important thing that we need to consider with holistic approach. And the problem is there is so much queue already. Think about booking an appointment in Mater Day, whatever it is. If Mater Day changes like in a day, week, that now we are practicing holistic approach, but literally, you know, in order to help the people deeper, we need to make a full consultation. And, you know, if we need 1 hour with every patient, we need 1 hour with every patient. What happens? The schedule will go very long. So it's like the doctors, they don't even have an option to be holistic into holistic approach because they don't have time. If you are asking certain questions which for you matter and for them, you know, this is wasting my time, you already feel that energy, you know, there are people after you, you are like creating, you're a bit selfish, right? Yeah, why are you asking so much questions? There are other people waiting. So please, now we're ready and you can go. So
not all doctors are like that.
But
I know that most of them perhaps.
But you know,
they are, but not all.
If you go in the general public, you know, in Mater Day, I think it's,
yes.
Unless you pay the person maybe €80, and
No,
instead
still
of
sometimes it's just
instead
5
of
minutes for €80.
instead of giving 15, maybe it gives you 30 minutes.
Yes.
Still, maybe there is something that you know, if his day is till 5 and he needs to go to his wife, whatever the professor is, he cannot stay till 7. It's still 5, so you need to take from someone else. So this is not holistic approach.
No, definitely. Oh, look, when there is money involved, forget about the holistic, unfortunately.
You know, what I think the solution is this about the holistic approach. I am learning how to help myself heal and prevent disease through essential oils and a holistic approach, right? And my idea is I don't want to be the healer. I now understand that I am my own healer and everybody is his own. And my intention today is to help the people learn their own way, their own approach, their own holistic approach to themselves and maybe to the people around them. Because we really need so much people who are into holistic practice. And I believe everybody can do this if they put in their intention. Like when I see a person who is beginning to feel some kind of problem, they are like staying on someone, Stephanie, you are the expert. Please give me something, a suggestion. I am all into you. I release myself from all the responsibilities and I give you all the responsibilities. And if something happens, it's your fault. And eventually, I don't think it's the good practice because the doctors and the holistic practitioners, they give you suggestion. They don't heal you. You need to help yourself heal.
Oh, yes, definitely.
But the people don't understand this. They stay in a position where they feel they need support. It's like
it depends, yeah.
We are in a relationship and I know I love you and whenever I need you, I put my shoulders onto you. That is not the way. We need to support each other, right?
Yes.
And I'm trying to help the people understand that everybody should take care of himself, herself. So as a holistic approach, we need to teach the people right from the school. In the school.
I wish that is something I dream of, to be honest.
In the education system, the basic is not maths.
Yeah.
How to take care of yourself.
It's something I dream of that.
But why?
Having 1 hour, like from young age,
their
garden.
The religion is a basic subject, right? A religion. Then there are so many religions. Why the Catholic Church? But someone. I disagree. So please put these factors, how to eat a plant-based diet, what are the vegetables, what are the fruits. Some children don't even know what taste and how to grow them, how to make your own food, and why we need to exercise. And this is not just PE, and football, and it's kind of sport or competition to make more money, business, and so on. So we need a holistic approach from the education system, and we need to teach the young generation how to approach simple things like, if you suffer from bloating, this is not normal. There is something wrong. Don't just feel and eat again and feel and eat again. It will go eventually if you fast a bit. But if you live in an everyday lifestyle that you are always bloated, something is wrong. So how can you manage it?
No, I totally agree. It's something I honestly dream of, but unfortunately, it's not something I can control. So that's why, at least if it's not at school, it's practiced at home with children. In fact, I admire you how you're raising your children, because it's how, at least it's the right way
But
how to introduce them from the very young age.
But you know what happens in my case? I am 8 hours full time. I
Yes.
prepare myself 1 hour and then to come another one, so it's like 10. And then I come in the afternoon, my daughter sleeps, wakes up 4, 5 sometimes. And she doesn't want to do this. She wants to go out, maybe at the playground. So time is short. If
But
you implement this in the education
of course,
time,
of course.
which is all day, it's education time, right?
Yes, yes.
But why should we play with the art for 6 hours, 8 hours at school and not in a garden?
Yes, yes, definitely. No,
No?
I agree.
So,
But at least, believe me, the basic, then they will still absorb, and even your wife, Chantel, she has the same, approach. So that time for sure they will, appreciate and they will find it handy. So what can't be do what the things that can't be done in the education, at least, because I totally agree it has to be in
yeah.
our schools.
But you know what happens is that there is so much pressure on the parents. You know,
Yes.
if I think about me and my wife, our relationship is almost near zero. You know why? Because there's
Yeah,
nothing.
because yes.
So if I just think that I am going to exercise every day,
No, that's why I'm telling you, everyone
no,
has his own, circumstances.
but
So it's
everybody has the same common practice. You need to exercise.
yes, definitely. I agree. So that's why then I said it's not just exercise, even just 5 minutes, but it's for you. Being in the morning, in the afternoon, doing something good, even do nothing, just closing your eyes.
Yeah.
So it doesn't mean because I do 1 hour, other people, no, definitely. We all have different lifestyle. If we could stretch the day by 25 hours, not 24, we do it as well. I
Sleep
know,
less.
I live, but that's why I'm telling you, like at least we try and find those few minutes, all we need sometimes. And that's already a holistic approach to ourselves. And when we do it to ourselves, we're more able to spread the word on how to do it. So ultimately, what I can, sort of conclude
Yeah.
is that if we're taking care of ourselves first, holistically, because before I practiced, I even passed through other experiences, and that's what then made me even stronger and believe more in holistic approach. So I experience, and I'm a person open-minded and ready to try things, which I know that they can do me good. And what I can conclude is when I give some time, even sometimes just watching a sunset, sunrise, close my eyes, read, hear music, I feel so beneficial. And it helps then in other things, in the outside world, even how to face the world once I'm out from home. It helps. It's that little thing every day can, help in our stressful life. And then we can tell people as well how to do it and the ways they can show it by sharing information. So
You know, it is beautiful when you think about what can we do to help ourselves. But when you put it in that 24 hours, do we really have the time? And you know what I see? One of those most people who are very good in maybe the holistic practice, people who are yoga teachers, who are maybe are full-time massage therapists, or maybe they are personal trainers. and they work part of the exercise, like example, personal trainer. They do the exercise as a work. So eventually they don't need to make ulterior exercise out of their work time. So they already have like time for them. So the problem is not everybody works the same.
Oh,
So we need to implement even in the job, on the job, we need to
yes,
have,
yes.
if you are sitting for 8 hours, the owner or whatever needs to have the employees moving around. And eventually they will promote this and even give some benefits. So this is not happening. And the system tries to not let you do the healthy approach by taking your time, So whoever is a parent like me, I understand, once you have children, time, it's like a sponge, literally. There is no time because they take much of the time. And I see that most of the people who are in that stress position is because that they have so many responsibilities. So hopefully this conversation will go somewhere. I'm supporting the IBS Malta support group, so if I can share that there, they can to know you as well.
Yes.
So and I'm sure I will see you another conversation.
Yes, yes.
Okay, so
For
if you can
sure.
share the website, you are Stephanie Borg. I don't know the website. Whoever wants to
Okay.
contact you,
Cool.
you can.
Yes, even if they go on Google and do Stephanie Borg holistic therapies, I have the Facebook page as well, holistic Stephanie Borg, holistic and beauty therapist.
Yeah,
I
yeah.
have my logo, orange logo with a heart hand symbol.
Yeah, and
So,
I guarantee that eventually she is my personal massage therapist. Whenever I have something like massage, I go always to her, even my wife. So from personal experience, for me is the best. So
and that's how you introduce me to that area. So it's I see it as a give and take. There's always a result.
yeah, beautiful. So thank you for participating in this conversation, the holistic approach.
Thank you.
So I hope we did a beautiful conversation, even for the people a bit long, but maybe I also put it on podcast. So whoever wants to just listen can do it as well.
Yes.
Okay. Thank you very much.
Thank you. Thank you.